Hello and namaste. This is Dr. Srinidhi Chidambaram. How are you all? I hope you've all been staying safe and well during this challenging COVID-19 pandemic. And I hope you're all following SMS. I hope you haven't forgotten what SMS is. Welcome to the COVID Care series presented by Apollo Hospitals. Pandemic fear is largely fueled by lack of awareness and of course, all the various hearsay and myths that are floating around social media. Naturally, you are very confused on what to believe and what to do, and that causes even more anxiety. Which is why we at Apollo Hospitals decided to bring you this series called the COVID Care series so that you get the most relevant, up-to-date, and factual and authentic information from the best of our specialists. Post-COVID recovery is a challenging period for many. There are quite a lot of symptoms which linger on, like cough or fatigue or lack of smell and taste, or a dry cough with a respiratory, there's still a soreness in the throat, or there is eye irritation. Plus, there is the compulsion for many of them to start their normal routine or start working because technically they have recovered. Yes, they may have recovered, they may not need isolation, and they may not infect others, but still, for them, the healing journey is not quite over. So to discuss this whole phase of recovering after COVID-19 and what is the ideal way of recovering so that, it all happens quickly and you feel better in no time at all, we have with us Dr. D. Vinay, consultant in infectious diseases from Apollo Hospitals, Bangalore. Dr. Vinay is an infectious disease physician, and he's been practicing at Apollo for a good many years with expertise in handling both simple and complex infections. He has over 7 years of experience post-MD, and he's also a National Board Fellow, Infectious Diseases from the Apollo Hospitals, Chennai. His specialty interests range from infectious diseases with a primary interest in lung and abdominal infections, prolonged fevers of unknown origin, TB-related HIV, obstetric and gynecological infections, transplant-related infections, adult vaccines, and travel medicine. Hello, Dr. Vinay, and welcome to our COVID Care series on FB Live. We will begin with your presentation on what is the ideal post-COVID recovery plan.
Thank you, ma'am. Thank you for the kind introduction. Let me begin with by thanking Apollo for creating such a platform where we are increasing awareness about an illness of which we understand less, but seem to know more. So every day, day in and day out, you see a lot of news coming out in the media, social media, or otherwise, which seems to be getting scary and scarier by the day. So this is a very nice and essential platform for us to discuss the do's and don'ts, the wants and whatnots of COVID and all the aspects of COVID that we know so far. If you are aware, the fear will be less, the anxiety will be less, and you should be able to help us out in dealing with this pandemic in a more responsible and in a more knowledgeable manner, because knowledge is key to a good outcome in this pandemic. Now, what we are discussing today is what is called as a post-COVID recovery phase. So now we are seeing a surge in cases of COVID over the last 1.5 months, but it never disappeared. I mean, we started having COVID since last March. There was a peak and then there was a decline, but it never went away. And then there is a second wave which is coming. So during this inter-pandemic period, there were many who had COVID infections and were recovering. And just about when we were understanding as to how we should go about this recovery phase, a new wave of COVID has hit us. So more patients, more infections, and then more of them getting out of the hospital. So the burden of infected individuals on the society is more. So it affects overall, it affects everyone at an individual level, at a societal level, and at an economical level as well. So how do we deal with this? How do we deal with this at an individual, with an individual perspective, and with a broader perspective as to keep everyone healthy. So that is the gist of current topic or today's topic. What I would do is I'll begin with a small presentation of few slides, giving you an overview as to what happens in the recovery phase of COVID and what we generally advise and how we go about. After which we'll have a brief discussion about the post-COVID complications as to how to deal with it once you're out of the hospital. And then I'm sure we'll take the question answer sessions where most of your questions, which are common for anybody who's come out of COVID or going through COVID, that we would like to answer. So if I could share my screen. Right, I hope my screen is visible at this point. Right. So post-COVID recovery plan. So this is the current topic of interest, and it is as interesting or is it as essential as managing COVID itself. So what happens, what happens when someone gets better, recovers from COVID, and then is about to go home or gets home or is at home managed with home isolation with all the treatment which was necessary. So how do we manage? So important thing is there is a discussion about what is an ideal post-COVID recovery plan. The truth is there is no ideal plan as such. It is a plan which is still in evolution. It's a plan where most of the scientists, we doctors, and everybody involved in healthcare is still understanding and learning. And as we go on, over the last 1 year, there are few possible strategies which have evolved, which we think works best for a patient. But what we have understood so far in the last 1 year is that there is no concept of one size fits all. So you cannot have an ideal plan, which is cut paste provided to everyone, and then not that everyone can follow this plan and then become better. What we need to do is we need to tailor and modify approach at an individual level. Each patient is different. Each patient has different levels of severity. Each patient recovers at a different rate, and each patient's recovery has different components to it. So there is no one single ideal plan. It is tailor-made and it should be based on individual's recovery rate and his assessment overall. So with this concept, what I'll be discussing over the next 5 minutes or so is what happens in general when there's recovery from COVID. So how do you isolate yourself? How long do you isolate yourself? What diet you take? How do you manage your diet? And then is there a need for exercise? How do you get on? So how do you recover from this post-COVID phase? And then there is an important concept which is evolving of late, what is called as post-COVID conditions. Post-COVID conditions, which I'll discuss later, is an umbrella term of what all Dr. Srinidhi just mentioned as to complications which follow COVID or some minor to major side effects which persist in spite of recovery from COVID. Media has termed this as long COVID, but now the clear term is post-COVID conditions, which I'll discuss later. Now, there are a few important questions in the minds of all of you who have recovered from COVID or just about to recover from COVID. Either you be at home or in the hospital with various levels of illness, various severity of illness, various grades of illness, and then you go back home. You need to get back to your routine. You need to get back out of this illness. You need to get back to your work. So how long do I isolate is the question on everybody's mind. The duration of isolation depends on the period of infectivity. We are not looking at just you, the patient. We are looking at the people around you. When you go back home, the essential concept is that you should not infect others. You should be in a phase where you have recovered, your immunity is improving, but at the same time, you should not shed virus and infect others. So this is called a period of infectivity, the time from where you get infection and the time till where you keep on infecting others. What is clearly established over last 1 year, now whatever I am discussing over the next few minutes is established data with bulk of data being taken from WHO, which is World Health Organization, and then CDC. These are the guidelines which we are essentially following over the last 1 year, and then most of it has helped us manage patients in a better way, in a proper way, and in a way where it is backed up by good evidence and proof. So what is known so far is the period of infectivity is 10 days for any individual who's otherwise healthy, who doesn't have any major illness. It is 10 days. You can infect others up to a period of 10 days. But for someone with cancer, some are already on treatment for cancer, somebody on treatment with other immunity lowering agents. It may be for a bad arthritis or any other condition, someone with chronic kidney illness, chronic lung conditions or chronic liver condition, and someone with very badly managed HIV or AIDS. These are individuals called as immunocompromised group. They can shed the virus and infect others for up to 20 days. So important term is 10 days in those with good immunity and 20 days in those with compromised immunity. So the duration of isolation is based on this. So what we do is, if you're an otherwise healthy individual, even if it is diabetes or hypertension, you tend to recover faster. You can break your isolation from day 14 from the onset of illness. And if it were to be an immunocompromised individuals, the isolation ends close to day 24 from the onset of illness. You take day 1 as the day where you had any sort of troublesome symptom. It need not be fever, need not be bad cough. It can be any troublesome symptom. It could be a bad body ache, it could be a bad headache. So that is considered day 1 of illness. So day 14 from there, you can stop isolation if your immunity is otherwise well. Day 24, if it were to be an immunocompromised individual, provided, the key terminology here is provided if you do not have fever for more than 2 days, you don't have worsening of any symptoms for more than 2 days, your oxygenation was stable. If it was always above 94, you need not worry. At some point, it was less than 94 and it is now stabilized for more than 48 hours. And there are certain inflammatory markers which your doctor would test. If these have shown a downward trend, they need not become completely normal. They were high and then they started showing a trend towards normalcy. If these criteria are met, then you can end isolation by day 14 or by day 24, depending on the level of immunity. So these are the important things which you should understand. Is there a need to repeat testing to either end isolation or to declare yourself cured? Is there an ideal time? No, it is not. So please remember, RT-PCR is only a test of diagnosis. It's not a test of cure. It can only tell you that you had an active virus in the system and you had COVID. And this matches well when you have symptoms. Once you were treated, once you recovered, the test does not have any validity to declare that you have now become non-infective or you're cured of the illness. The reason being, the test is sensitive enough to pick up even dead virus. There may be some individuals who keep on shedding the virus for a very long time, say up to 3 months or 90 days as well. This has been documented in close to 50 to 80% of the population. So for up to 3 months, the dead virus can still stick onto your nose and throat, and the test can even give a false positive result in these cases. So never use a RT-PCR to declare yourself cured. The cure is decided by the treating team based on your clinical parameters, like I discussed in the previous slide, and also certain blood parameters, like I discussed, and not by RT-PCR. So my request to all of you is not to insist on a repeat RT-PCR testing. It really doesn't help you in any which way. It may just, relieve you of your anxiety that the virus is gone, but doesn't essentially mean the disease is gone. So repeat RT-PCR is a big no. Now, what is the time to recovery from COVID? It depends from individual to individual. Like I discussed in the previous slides, it all depends on one individual is not the same as the other, and it may be in the same family, same home, same room. Your time to recover varies from person to person. Even in twins, we have seen the rate of recovery does vary. It is never the same. And it also depends on the level of sickness. So it is obvious that those who were sicker will take a longer time, and those who were less sicker will take a shorter time for recovery. Important thing, and that seems to be the concern in many individuals, that the taste and smell sensation is not coming back. Does it indicate that I have not completely recovered from illness? So it doesn't essentially mean that. What it shows is that your taste buds and your smell sensation was hampered by virus, and it takes a long time for body to heal itself. It may take many weeks. So don't be discouraged, do not worry, don't get anxious. These take time to recover. The recovery of these sensations may be as short as 3 days to as long as 3 months. So do not worry at all. Post-COVID fatigue and tiredness is expected in almost all the individuals in the recovery phase. So what helps you overcome this fatigue or tiredness is a good nutritious diet. Again, there is no one size fits all. The diet, what you can tolerate, varies from person to person. So if you're tolerating the diet, it may be a routine diet. If you're able to eat that, if you're able to consume that, you still will be able to get over your illness and then get better over a period of time. The rule of thumb is, please add more greens to your diet. Please add more vegetables, preferably in a boiled way. Have more fruits, have more pulses, more protein intake, milk, ragi, or any such alternate is a good one. No individual needs supplement on a routine basis. Supplement is reserved only for the sickest of individuals. If you're otherwise healthy, your own diet, a good nutritious diet with good hydration, will help you in a stable recovery process. Some individuals will have a residual oxygen requirement for quite a while. I'm sure in most of the hospitals, they have a chest physiotherapy program, and that has to be continued at home as well. They will be taught a lot of breathing exercise, at least in our institute, that's what we do. We plan in a way that the individuals who are getting discharged but need oxygenation as a continued support, we provide them with just physiotherapy support, which is continued even after they go home. We teach them breathing exercises. This helps in overall recovery of lung function. It takes a bit of time, but ultimately recovery does happen. Please remember, recovery to your physical activity to a level pre-morbid, that is before the disease set in, the level of physical activity you had, if at all you had one, for that to come back, it takes time. Always, please be slow, take it one step at a time. The recovery, your body needs time. You don't push it. You don't have to work so hard to get back to routine. Some people I've seen start running from the day they go home, they isolate or break isolation. It need not happen that way. It is always time consuming. It is fine. Please allow your body, your mind to recover. Listen to your body. The day you feel, okay, you're better, you're good, you can do it. Start off in a stepwise and gradual manner so that you achieve full level of fitness. So these are the general rules when it comes to an individual who's recovering from COVID. Now, there are certain things which we notice once the individual has recovered, gone home, and then some of the symptoms either continue or they come back. These are together termed as post-COVID conditions. It's an umbrella term, also called as long COVID, for many symptoms which continue for more than 4 weeks from the day you recover or your doctor declares you are cured or recovered. More than 4 weeks. So this is an arbitrary cutoff. It may change with time, but this point of time, more than 4 weeks, if you have fatigue or any of other symptoms, it's called as post-COVID condition. Like I discussed previously, tiredness is the most common presenting symptom in these set of individuals. Some end up having what is called as, or what is mentioned as, a brain fog, where they have difficulty thinking, concentrating. Some people have difficulty breathing with or without a problematic lung function. Most of them have cough. Most often it is dry. Some may have a productive cough where they bring out sputum. Some individuals complain of bad pains in the joints and muscles. Some do have chest pain. Some individuals do have depression or anxiety. This more and more we see with individuals who are isolated for a longer time, or individuals who do not have adequate social or family backing. They end up with depression or anxiety. And individuals who are otherwise very healthy, very active, if at all they're made to isolate for a longer time, they end up with anxiety and depression. This is also part of long COVID. So headache, fever, palpitations, that is awareness of your own heartbeat. And like I mentioned, loss of smell and taste, dizziness, all these can happen. But please do remember, at this point of time, there is no one single medication which will help you overcome. So general rule is get back to your nutritious diet, good family backing. Please talk to your family, your friends, be in touch with them all the time. Don't be indulging in news channels all the time. They're good in a way, but not in the long term. Please listen to more and more positive news. Please do remember, overall in our country, the recovery rate in the last wave was close to 95 to 96%. That is, so many of them went home well. And even now, it is close to 92 to 95%. Maybe there are a lot of deaths reported, but the number is coming down. So you will ultimately get better. Your post-COVID complications will also ultimately get better. It's always good. I mean, if you have backup, if you have support, we are always there to help you. So please do remember, be in touch with your family, be in touch with your healthcare providers. All these symptoms can be managed, though there is no one single medicine to do so. As we discuss in the next question answer session, we'll take up individual questions and then we'll see how we can sort out the problems. So this is overall, in a nutshell, how COVID, once you recover from COVID, what you need to do. But I'll be happy to take the questions and answer those in an individual manner. Thank you.
Thank you, Doctor. I wanted to ask you, you were saying about the period of isolation for immunocompromised patients. So does that also include people who are taking, for example, for an arthritis, they take something like a methotrexate or something like that? And how do you know that they are immunocompromised? People who may be taking such medications, and when they get COVID, I mean, do they also have to isolate for 20 days?
So like I mentioned in the slides, I think the characteristic immunocompromised are those with these conditions: cancer, and those who are on chemotherapy for cancer, and those who are on high-dose immunosuppression. Methotrexate in general, if at all the dose is minimum, say 5 to 7.5 over a week or so, and they do not have any symptoms attributable to methotrexate, that is, they do not have recurrent fevers, their blood counts are all normal, they are not essentially considered as immunocompromised individuals. So in them, if at all the recovery rate is faster, they can also break isolation within 14 days. But if these set of individuals had a longer duration of illness, then 20 to 21 days or 24 days maximum would be the period of isolation. So it is not for individuals who are on a lower dose of immunosuppressing agents. This is for high dose immunosuppression that we take for 24 days as the period of isolation.
Also, I wanted to ask you about, you were saying that there's no need to do the RT-PCR, but generally then people do their IgG antibodies and then wait for their presence. But there's also recently another test which people are doing, which is the ECLI, the quantitative antibodies. So, and there is even a table which says that if one is positive, one is negative, what is interpretation? So do all these things actually need to be done by individuals? But sometimes there is a pressure, that they need to show something that they are negative before returning to work, or things like that. Sometimes there are demands by other people that some certificate of recovery is needed.
In the end, the recovery is mainly clinical. It is all symptom-based. It is based on the level of oxygenation. It is based on your blood parameters, the inflammatory markers that I discussed. There are a few of the markers which indicate disease activity, including CRP, D-dimer, ferritin, which we monitor over time when the patient is under our follow-up, either in the hospital or outside of it. And then we look at the clinical progression. That is, how were your symptoms when we saw you first? How did the symptoms recover over a period of time? If you have good symptomatic recovery and met all the criteria which I discussed in that slide, you're as good as recovered. So what we do, at least in our institute, is like we don't have a policy of repeat testing. If at all there is a demand or a need, it may be from a resident welfare association, it may be from your own company, which wants you to come back with a negative report. The first thing we do is we tell them, we write in the diagnosis and we give a medical certificate saying, because these parameters have been met, have been objectively satisfied, they are non-infective, they're recovered and cured. But in spite of that, if at all there is a need or demand for RT-PCR, we do so. But in 50% of the individuals, we have seen that the RT-PCR remains positive. So that's the flip, that's the drawback of RT-PCR. So they go on for multiple tests till it comes back negative. There are cases where they've gone on for 6 to 8 tests before it has come back negative. So we in general do not encourage it, but on a case-to-case basis, sometimes we do accept, we do RT-PCR. Coming to antibody, now what we have understood over the last 1 year is we haven't understood well anything at all. So, I mean, it's not an understatement. So when I say that, what I mean is antibodies, we are not certain at this point of time, really mean that you are protected from the disease and you're non-infective. They do not actually represent that. What antibodies represent is you had infection, your body began fighting the virus and did something so the virus came down, either all by your immunity itself or with the help of medication. So you were infected and the antibody shows that you were infected at some point of time. This happens in many of the illnesses. I mean, classic example in our country being TB, tuberculosis. So we do a test called MON2. MON2 is wrongly used to interpret diagnosis of the disease, but it only shows that you were exposed to TB at some point of time. This antibody level also probably means the same. Though by and large, if at all you're better and then you have a positive antibody, remember antibody forms anywhere between day 7 to 3 weeks once your illness begins. That is, it takes that much time for the antibody to form. Sometimes it may be delayed by 4 to 5 weeks also. So if you do not have an antibody at the end of 3rd week, but you have completely recovered, it doesn't mean you are still infected. That is one thing. And if you develop antibody by day 7, you still continue to have symptoms, it doesn't mean you are still recovered from the illness and cannot infect others. So there are too many ifs and buts to this. So in general, using antibody to decide you're completely recovered from illness probably is not a good idea. If you're completely done well, your doctor feels that your symptoms are gone, your blood parameters have settled down, and on top of it, if you have antibody positivity, then you can accept, yes, you're recovered from illness, and you can present it as a proof.
Doctor, can you remove your PPT so that we can see you?
I'll stop sharing. Is it fine now? One moment. I'll stop sharing. Is this okay now?
This is fine. Thank you.
Yeah, fine.
So we will now start with some of the questions which are coming to us on the FB Live. And if we have time, we'll take some more questions. What is the normal oxygen saturation post-COVID recovery?
Okay. So it's not just post-COVID recovery. I mean, what we aim to achieve is a saturation of 94% or more. But please do remember, this is in a normal setting where you are not infected, your lung is all fine, and you are a completely healthy individual. So now, for example, you are someone who was in ICU, recovered over a period of time, is in the ward, and over, say, 5 to 6 days, your oxygen level was 92% and above, with or without oxygen support. We accept even 92%. Now, given the situation where your recovery might take a longer duration of time, we are targeting an oxygen level of 92%, either without oxygen support or with an oxygen support of less than 2 liters per minute, with which we can send you home. Beyond 92%, a stepwise approach is ideal. And if at all, at some point of time, 94% can be achieved, that is what we are targeting. But again, like I said, it may vary from person to person. But at the end of the day, at least 2 to 4 weeks after you're gone home from the hospital, your oxygen level should reach 94% and above, which is meant to be normal.
Thank you, Doctor. This is a question on steaming. Recently, there was a lot of social media hype about steaming. So this person is asking, is it good or bad?
Steam is not a medicine. So neither is it any form of therapy. It is just a symptom reliever. So the basic idea is that it decongests your nasal lining, maybe your throat and all. It gives you symptomatic relief. It has, mind you, no role in curing COVID, in killing the COVID virus whatsoever. It doesn't really mean that the greater the amount of steam you take, the greater is the advantage and you get better sooner. It's not like that. It is mere symptom relief effort and nothing more than that. We have had patients where they have gone into steam for 10 to 12 times a day, have just had some burn injuries on the nose and all. Please do something within a limit. It is not therapy and it does not have any role in curing COVID at all. It's only for symptom relief.
In a constant low BP of 90/60 or bordering that, for a period of 2 weeks after COVID, is this okay?
It all depends on what was your baseline blood pressure. I mean, if you were an individual, if at all you have known your blood pressure from before, and it was always hovering around 90/60, was not hampering your life, and you're back to that post-COVID, it really doesn't make much of a difference. But you're recovered from COVID, this low blood pressure is something new, and it is causing symptoms like dizziness. You are sitting or you're lying down, and then you try to stand up, and then you have giddiness, you have the room spinning around you, yourself spinning, then it is not normal at all. So, but if you're able to sustain your daily activity, blood pressure of 90/60 is still acceptable. But any symptom which is attributable, which was not there before, and you have a blood pressure of 90/60, it is time to consult your doctor again. And there must be something wrong either with your diet or your nutrition or your hydration or COVID per se. There may be some complication which your doctor should be able to identify and deal with it. 90/60 without symptoms is okay. But if you have symptoms, do consult your doctor immediately.
Yes, we did talk about the antibodies after 15 days. You did answer that already. But also, do you have to take these antibodies after the second dose or the first dose of the vaccination as well?
Again, I mean, the same concept. Like I said, there is a lot of obsession with these antibodies. I mean, to the extent that people are competing using their antibody levels. Mine is this, yours is what, and so on and so forth. I mean, mind you, even doctors are doing that. It's sometimes strange and funny. We have not clearly established that presence of antibodies, even with quantitative antibody titer, it necessarily indicates you're protected from the illness. It doesn't necessarily mean that you may not get reinfected over a period of time. We'll discuss what is the duration of protection, but it doesn't necessarily mean that. What is understood is that there is something called a cell-mediated immunity, which cannot be truly measured. It can be measured only in some experimental labs or so, which probably is more protective than the antibody per se. So it really doesn't indicate that you have an antibody or protection is good. So measuring antibody either after the disease or after vaccine does not necessarily indicate you will not get infected. So I hope and I pray that the obsession with antibody comes down. And please only monitor your symptoms. Take the vaccine, but monitor your symptoms. Don't go by the notion that you have antibody, you will not get infected at all. That is not the truth.
Doctor, I also wanted to ask you this. Now, when a person gets COVID, now there is a little confusion as to whether each person who is tested positive must consult a doctor so that, they can guide them through their own journey with COVID, which varies from person to person. Or you just need to, like do the self-monitoring and take your paracetamol, isolate, and then only if there is something, because there's a lot of confusion among people as to, do you need to do the blood tests like, CRP or D-dimer, or do you need a CT? Some people do a CT by day 6 for everyone, or some people say you don't need to do it. So is it better to take the advice and guidance of one doctor throughout this entire period, or you just need to consult them because there's so much of pressure on doctors also? So should we just manage by ourselves with paracetamol and all the just taking rest and, isolating? Is that enough? And measuring your saturation, I guess.
What I tell my patients who probably are on long-term follow-up and then become sick, probably they have symptoms suggestive of COVID, or what I tell people in general whenever there's a talk is, whatever we said, self-monitoring. This applied very well during the first wave because there was a set pattern of progression of illness. We knew up till day 4 to day 6, you'll have fever, and after that anyway, you'll get better if at all your immunity is otherwise well. Now, the second wave has puzzled us, it has kind of shook us, and then it has made certain things unbelievable. So at this point of time, what I would generally suggest is, if you're someone whose health is otherwise well, you're constantly monitored your health, you're keeping well otherwise, you're less than 50-year-old, and you're monitored your blood parameters, have a regular health check done. If you have some symptoms, fever, headache, sore throat, cold, for the first 2 days, yes, take paracetamol, maybe something like a cetirizine. But if you have these symptoms continuing or going on for more than 48 hours, please do consult a doctor. If you're someone more than 50, if you're someone with diabetes, hypertension, body weight more than what is expected for the height you have, please do not wait at all. The day your symptoms begin, at least have an approach, at least talk to a doctor and then get to know what you should do next. Now, what happens after you see a doctor depends on the expertise and the level of knowledge that your doctor might possess. I do hope that doctors update themselves time and again. Now, blood tests are not mandatory for everyone. So what we have as a policy here is we do look at the level of immunity again. Somebody who looks very sick, somebody who has risk factors like bad diabetes, hypertension, which is not under control, or any of the chronic kidney, liver, lung, or heart illness, we do ask for a blood test by day 3 to day 4. But if someone is healthy otherwise, we monitor them, give them symptom control medication, we keep them under follow-up, tell them to inform us if at all something is not all right with you, and then let us know if something goes wrong. So we monitor them up to day 5 to day 6. Only if they are not getting better by then, we ask for certain blood tests which are very basic, some inflammatory markers which are also not exotic, and then we monitor. CT scan as a routine, most of us really do not believe in that. There is a big hype and there is a big discussion going on that the RT-PCR and any similar tests are not good enough. They do not pick the test even if you have illness, and hence CT becomes mandatory. I think this is a wrong information. CT would become essential only in those individuals where oxygen level is dropping or is less than 94%, or in those individuals who have, like I listed previously, immunocompromised. Please do not ask for a CT. It is a lot of radiation exposure. We can still diagnose with RT-PCR. Say, for example, you are someone who's well. Your RT-PCR you did on day 1 or day 2. It is expected to be negative in about 30% of the cases. So you still continue to have symptoms. We ask you to come back after 48 hours. By day 4 to day 5, we repeat your test. If you truly have the illness, it will come positive and we'll manage. Irrespective of your test, the treatment remains the same. Please remember, time and again, I'm reiterating, the treatment depends on the symptom you have, the background illness you have, and the symptom severity that you have. Neither CT nor blood test will help us understand the severity unless until your symptoms correlate with them. So let your doctors decide when to do the blood test and when to do the CT. CT from the word go is a big no.
Can COVID come back even after 20 days of recovery?
No. What we know so far and what we can probably do with a great deal of belief based on proof and evidence, we can say that till 3 months after your recovery from an established COVID, you probably will not get reinfected. After 3 months, none of us are very certain. Now, what happened after the first wave? The data suggests that your antibodies will persist for up to 8 months. But like I discussed previously, whether antibody truly correlates with protection, we really don't know. So what is advisable is up to 3 months, yes, you may not get reinfection at all, but that doesn't mean you drop your guard. Like we discussed previously, SMS, distancing, mask, and sanitization, you do continue at all the time. And after 3 months, yes, you do become more wary of it and then continue it in a very vigorous manner. Infection beyond 3 months may happen.
Doctor, what about vaccination post-COVID recovery? So when can they take their vaccine?
What is generally advised is either at a second or first dose, please to take your vaccination 6 weeks from the time of illness or 4 weeks from the time of recovery. The reason being your body will be fighting COVID, will be producing a lot of antibodies. If you vaccinate yourself during this phase, it may so happen, it may be identified as the virus and the vaccination might not work well for your body. The effect may not be there at all. So the general rule is either 6 weeks from the day of your symptom or 4 weeks from the day of your recovery, you can go for the vaccine, either the first dose or second dose.
Post-COVID recovery, there is a lot of body weakness. Can you suggest what foods and medications we can take?
Right. Like I discussed in the slide previously, I mean, there is no one good food or good diet which will fit all. It all depends on what is your health state previously. So if you're an otherwise healthy individual, then you need to go back to the basic. That means eat a lot of green leafy vegetables, plenty of fruits in your diet, increase amount of pulses. It can be anything. It can be dal, have more of milk, have more of ragi-based diet, or whatever is staple in your region. Please to take them in a regular manner. It becomes difficult for individuals who have just recovered to take in a bulk of diet. What you should do is short, frequent meals. You can break down your diet plan into every 2 hours or 3 hours. Have a bowl full of meal which has more of these green leafy vegetables and fruits, more of milk or any of milk protein that you can take in. This will help you recover from the fatigue that you're complaining of or the pains that you're complaining of. Please to remember, it varies from individual to individual. You don't have a fixed plan as such. Continue taking in your diet, gradually build up your physical activity. All these pains will disappear over a period of time. If you're someone who's diabetic, has some chronic illness, please do manage them in an optimum manner. Only when your underlying illness is taken care of well, all these other problems also will disappear over a period of time. Diet alone may not help in such individuals. You need to make sure your underlying illness is very well managed.
Do post-COVID symptoms become fatal or dangerous?
By and large, our experience is the post-COVID symptoms, post-COVID complications, the fatality is directly proportional to the way you are managed during your COVID. If you have a good team which took care of you, and if you have a good team which managed your other illness well, your diabetes, hypertension, other chronic illness, your immunocompromising conditions well, trust me, the rate of complications post-COVID is minimal to nothing. So this we tell you, or I'm telling you based on our experience of our group of institutes where we have a set policy, fixed policy, based on multiple experts from various fields. What we have observed is the patients we have managed in an optimum and in a better manner, most of them or almost all of them have not come back with complication. Even if they have come back, those were minor complications which were still taken care of. Post-COVID complication can happen if your COVID is not managed well. So COVID recovery, if it is good, post-COVID complication rate is minimal to nothing.
I've completed 21 days from day 1 of the symptom and I have recovered now, but I'm still having cough. So can I break my isolation and play with my 1-year-old baby?
Again, cough per se is expected in many individuals. I mean, cough will go on for quite a period of time. If you do not have fever for the last 2 days, your cough is the same. It is not getting worse. You're not bringing out a lot of sputum, more sputum day by day. You're not feeling tired day by day. The rest of it, except this cough, maybe which is a dry cough, you're getting better, then that means you're kind of non-infective. Then you can go play with your child. But what we usually also prefer is till your symptoms completely resolve, though you can break isolation, please wear a mask when you're around your child. Though it seems difficult, at least you can attempt doing that. Plus, please also speak to your specialist. There should be a reason why your cough is still going on. They can think of what is the probable reason and manage it at the earliest so that you get good symptom relief and you can also be stress-free.
My back aches a lot post-COVID and there is a persistent cough. What can be done?
Cough, like I answered in the previous question, I mean, there needs to be some reason for it. Most often the reason can be a healing lung. Lung undergoes scarring, like any injury. I mean, if at all you have a cut, you have a scar at the end of the day, scar takes time. Lung also heals by that, if at all your illness was severe to begin with. So anything which is not normal inside the lung irritates the lung and causes coughing. So this is the most common cause why a dry cough goes on for a period of time. So what we do here is we identify that early. And if at all we come to know the patient has post-COVID scarring or lung fibrosis, we add certain medications which help him recover and overcome cough. So again, it varies from person to person. So I'll not be taking name of any medicines as such, because generic medication intake doesn't really help at all. You need to talk to your doctor and understand why the cough is still there. Backache, there could be two reasons why the backache could be there. Some of the individuals have disease which is predominantly in the lower part of the lung, and it is very close to what is called as a pleura, which is the lining of the lung. So in these individuals, backache starts off when COVID starts also, and it takes some time to recover till the pleural thickening or the inflammation there comes down. Their back pain also gradually settles. Simple medicines like a paracetamol does help in these cases. Sometimes something like an aspirin also may be needed, but very rarely. If it is not the case, but you still have backache, this happens very commonly in individuals who have isolated and not been physically active for a long time. So what we tell them is gradually build up the level of physical activity. Don't hurry, don't rush into it. If you start off exercises one step at a time, it could be something like standing against the wall for a long time, just a sit up, which is not hurting you much. So you can gradually start off, do a regular walk, maybe half an hour per day. Increase the level of briskness, the speed of your walking over a period of time. This will help your muscles become active. It will break the spasm of muscles. You can overcome backache. So this is the general thing which you can do.
Okay. So thank you, doctor. So we have more questions, but we're running out of time. So if you have more queries, viewers, please put it on the comment section or on Facebook Messenger. And thank you very much, Dr. Vinay, for that very informative and very lucid and clear discussion. I'm sure everybody found it very useful. Tomorrow, viewers, we are going to talk about knowing your prescription in case of COVID-19 infection, which means that we will be discussing about the various medications and how your prescription could look like if you have COVID-19. And this will be discussed by Dr. Lakshman Jasani from Apollo Hospitals, Navi Mumbai. Now, don't forget to SMS, which is socially distance, wear a mask, and sanitize. Stay safe and don't hesitate to reach out to us at Apollo for any COVID-related care and support. As I told you, Project Kavach addresses every aspect of COVID management, ranging from video consults to the best of specialists to guide you through your isolation at home or at a hotel, and of course, expert COVID care if you happen to get infected till you recover completely. Thank you, namaste, and Eid Mubarak to all those celebrating. Prayers for the health and safety of humanity across the world. Thank you.